Okay. All right. So I think I'm recording, right? Double check. Recording is in progress. Okay, so do carbohydrates cause obesity? And I said yes, in my opinion, when I've read the contribution to weight gain, high protein, high fat, or high fiber content versus refined or added sugars. All right, so you guys, I think in the next discussion, I gotta make sure I open that up. Yeah, I opened that. I'm pretty sure it's open. Yeah, I'll check. It's 100% positive. It's automatic. You guys can discuss carbohydrates or these diets. You can do Atkins, South Beach, whatever you want to do, and research it. Combination of starches and sugars with hidden fats. But the primary, even though fats have more energy per gram than carbohydrates, carbohydrates are just converted to blood glucose faster. And we said before, if there's too much blood glucose and your cells can't absorb all of it, if there's not enough receptors to do that, it goes to liver as glycogen with glucagon from the alpha cells. But at some point in time, when the liver is full of glycogen, then your body takes it and it's going to store it as fat. And that was by design back in the day when we didn't have abundance of food. And in winter, when the food was maybe scarce, we wanted to have a little bit of extra. Number one, we wanted some fat for insulation, for heat, and you want a little bit of storage of energy in case things got real lean or it was super cold and you couldn't go out and hunt, or maybe you were out of whatever you had in the root cellar or whatever. And you also want some fat around your organs, all right? So I think I mentioned before, you want a little fat around the kidneys. For the adrenal glands, you want some fat in the back of your eye socket to hold that in place, and you need some fat some in places of your body. They're just kind of to pack organs in so they don't move around as much. It's like bubble wrap, really. So high carbohydrate, high fiber diets, more than 70% of energy as carbohydrates. Right. Carbohydrates for weight loss. Well, I don't really know if you still want to consume carbohydrates. Let's just think of a better carbohydrate. All right. So high carbohydrate, high fiber diets. All right. That's where more than 70% of your energy is carbohydrates. So that's an extremely high. And there are some people that don't eat any fruits or vegetables, and some people that don't like meat per se. All right. So diabetes. So diabetes mellitus. Mellitus means sweet or honey. So abnormally high blood glucose levels. Type 1, it's only 5 to 10% of diabetics, and there's type 2. Type 1, diabetes mellitus is the general term. But type 1 diabetes is when your body can't produce insulin, right? Or doesn't produce enough of it. And sometimes it could be a problem with the receptors in the cells, but for this course was to say that your body can't produce insulin. Type 2 is when you usually used to happen later on in life when you either burn out your pancreas, you burn out your beta cells, or you're having carbohydrates so often that you don't have any room on your cells left for receptors or the insulin, or they're used to getting insulin and sugar every waking hour for 18 hours a day, and they just stop responding to it. So fasting blood glucose levels is how we can check that. So normal would be 70-99. Pre-diabetic would be 100 to 120. So they're going to say, we're going to send you in for glucose tolerance test. You can't eat the night before. They're going to give you some really sickening sweet syrup, and then you come back like 20 minutes or 30 minutes later, and they check your glucose levels. And if things are normal, your blood sugar will be between 70 and 99. Right? We want to be under 110. If you're pre-diabetic, if you're right on that cusp, it's going to be high, 100 to 125. If you're diabetic, it's going to be like 126 or higher. So what are some symptoms of diabetes? All right. This is a serious subject because we're seeing this in more and more of the population. And we're seeing at younger and younger ages. So it used to be standard, it was 40 to 45 age range when we started seeing this type 2 diabetes. And that was just people poorly eating, burning out their beta cells. But now we're literally seeing it in elementary school. We're seeing it in middle school. We're seeing it in high school. Yeah, it's ridiculous. That's because these kids have poor diets, all right? And if they're eating, it's going to be mindlessly in front of the TV, or they're eating breads, pastas, processed mac and cheese, just way too many carbohydrates. It's burning out their pancreas. So they have excess thirst because the blood sugar in their blood is so high. The osmolarity is so high, it's literally pulling all the fluid from their interstitial tissue into the bloodstream, and you have to replenish that through drinking. All right, so the kidneys are working overtime. Frequent urination, once again, they're pulling all that fluid into the bloodstream because of the sugar level is so high. It's pulling, the osmolarity is pulling that fluid in, and they're making more filtrate, making more urine. Blurry vision, that can be twofold. Number one, it can be the high glucose can start changing the curvature of the crystalline lens. It can start changing the curvature of the cornea. And the other problem is with diabetes is you start destroying that high osmotic pressure, and all that fluid in the capillary beds starts bursting the capillaries, which is what feeds all your cells. So they're destroyed. So it causes your diabetic retinopathy, your diabetic neuropathy. So it starts destroying your retina. Your distal toes, your diabetic neuropathy starts killing, excuse me, all the tissues and all the nerves. All right. Vaginal yeast infection because it changes the pH. All right. Foot pain because you're destroying the capillary beds to your feet. Abdominal pain. Right. Impotence. All right. So number one, men who have erectile dysfunction, number one thing is going to be a heart. It's going to be a vascular problem, and that's because you're destroying all the capillary beds. You can't get blood to that area. You can't have an erection. All right. Sores that do not heal quickly. Once again, you're destroying your capillary beds. You can't get blood to the area, and without blood to the area, you can't get the nutrients and the macrophages and the neutrophils and things to the area to clear up an infection. And there's people with diabetes that have it for decades and don't do anything about it until they start losing their toes, or they start losing their feet, or they finally they don't listen, and they have to end up going on kidney dialysis because they destroyed their kidneys. I could spend a whole hour on that alone. Untreated or poorly controlled diabetes, nerve damage, lower limb amputations, and blindness. I just kind of went through that. Damage to organs, heart disease, kidney failure, damage to blood vessels, blindness, lower limb amputations. And anyone who's going into any kind of healthcare where if you work at a podiatrist's office, you'll see these people, they can't feel their feet, they say it burns, and then if you watch TV, there's medications that'll stop the burning. Well, you've just got rid of the symptom, you didn't get rid of the problem. All right, so yeah, so it's just stop eating carbohydrates. It definitely will help. Seventh leading cause of death in the United States, and I think that's low. It's probably number 5, because diabetes is going to start contributing to heart attacks. You start having ischemia of the heart. That'll cause COPD, cause respiratory problems. It can cause increase in stroke. So that's low. I would say it's much more prevalent. Yeah, much more prevalent, because all of these things can be linked to some form or some sign or symptom from diabetes. 25 million diabetics, that's in 2010. I guarantee you that's at least doubled by now. I mean, just look around. Look where you go, look around. Any of the stores or people, it's nice for all people are hopefully out walking. But I live by UB, and I just see even the college kids are large. Yeah, we won't get into that, but just look at the population now. It's absolutely mind blowing. When I was in school, back in the 70s and late 70s, early 80s, middle school, high school, and even when I first started college, I don't honestly remember anyone in my elementary school who was obese. I don't remember anyone. All right, maybe 2 people in my high school that were obese. Now, yeah. Anyway, diabetes type 1 is an autoimmune disease, genetically susceptibility, environmental factors, and viral intestinal infections can start affecting the pancreas. Its inability to produce beta cells. So they need insulin injections or an insulin pump. Right? And please, well, these people really, for their life, have to monitor their blood sugar, and they're wearing an insulin pump. It's going to give them a steady dose of that, and they have to be careful with their blood glucose. And if they don't eat and the insulin pump goes off, it can take whatever blood sugar they have in their system and put it into their cells. And these people can get hypoglycemic, and they'll start slurring. They'll stop. They won't make any sense, or you'll be talking to them and they'll just be incoherent, and then say when the last time you ate, and then get some sugar packets and do something. So that can be scary. All right, poorly controlled diabetes type 1, increased appetite with weight loss, breath that smells like fruit, fatigue, or confusion. So the other thing is too, if you are talking to someone and they're acting really weird, you might think they're drunk, or some people might be driving very erratic. So they could be under the influence of alcohol. Now marijuana is legal. Or they could have super low blood sugar, where they're getting delirious and they get brain fog. And I've had it happen where I've been hypoglycemic, and I can tell. I'll stop and say, I have to eat something like now, because things will get real foggy. And if you know someone who's diabetic or type 1, they'll tell you they get hypoglycemic. Type 2 diabetes is more common form. This is insulin resistant. That's because they've been eating carbohydrates and burning out their pancreas since probably age 3 or 2, 3, whatever. These people are generally physically inactive, overweight or obese, almost all. Genetically predisposed, maybe. Ethnically predisposed, that's possible. There are certain populations, Mediterranean, they're saying African Americans sometimes are more genetically and ethnically predisposed to diabetes. All right. And sometimes these things can just come from um, dietary habits, or, let's say that you didn't have all that, but your spouse or your girlfriend or domestic partner or whatever it happens to be, it does, nobody cares, whatever, um, has a poor diet, or they're eating a lot of carbohydrates. This can start happening. Or conversely, let's say that you're diabetic and you've always been diabetic, and you start eating healthier because your partner's eating healthier, or you're taking nutrition and you're realizing, I got to make some better choices. And, I wish this was a full semester course where you can see, and I have students tell me all the time, I thought this course would be terrible, or that, I say it was terrible, I didn't like it, but I started eating better, I was sleeping better, I had more energy, my skin looked better, my hair looked better, I was thinking better, things like that. But with diabetes type 2, it's usually it's uh, dietary intake, poor choices. Right, so managing type 2 diabetes, regular exercise. Right, this is key because I said before, there's a lot of muscle cells that can take glucose in without insulin. So if you are diabetic and you can't produce enough insulin, or you've got no more room on your cells for receptors, or they just stop paying attention, you can do exercise. It'll start burning off that extra glucose in your blood, making things a whole lot better. And then hopefully your capillary beds will regenerate themselves and you'll become much healthier. Weight loss, remember too, for every pound of body fat that you have, your body has to produce a mile's length of capillaries. All right, and those are super tiny, enough room in there to fit one red blood cell at a time through there. Special diets, and that would be, by special diets, I just mean being mindful of what you're eating. And it might be a matter of, um, you know, no sugar, or diabetic sugar, diabetic candy. Um, I see, I worked with this person who would have a Slim Fast shake, and then an hour later, candy bar. And I'm thinking, okay, that's a choice. Right? And medication, metformin, and some of these other things that help bring glucose into the cell. Now, gestational diabetes happens when a female is gravid or pregnant. All right, affects the fetus and baby because these babies are high birth rate. All right, there's pregnancy risk, post-pregnancy diabetes can happen, residual from that. There's also always a risk of developing type 2 diabetes after the pregnancy. So monitoring diabetes, achieve and maintain normal blood glucose levels. So that's meal planning, having better choices for carbohydrates, keeping your blood sugar stable, and right around that, hopefully right around that 90, or between 70 and 90 if possible. Blood monitoring, testing constantly, just checking. And like I said, I've known people that will check their blood sugar, diabetics, and the minute it's normal, they're eating. I didn't have any sugar. I just had pasta, or I had a sandwich. So that bread was converted to glucose almost immediately. So was that pasta. Hemoglobin A1C. This is how we do a glycosylated um, hemoglobin. We can check your blood sugar for a 3-month period by doing that. Fasting glucose, we can check, we can get a snapshot then, but glycosylated hemoglobin, checking the A1C, by checking that, we can see, checking your red blood cells, because they consume all that sugar, we can check and give you a snapshot of the last 90 days. All right. And I definitely have a problem with someone who, if we do their A1C and it constantly comes back poor, like, I don't know. I guess my theory is, well, why is your insurance company paying for all these medications if you are not going to control your diet? Just my horrible thought, but so individualized treatment plans, because everyone's a little bit different. All right, so it can be a combination of less carbohydrates, more physical activity. And physical activity, you know, someone says, yeah, I exercised. I went all the way out to the mailbox and came back. Went all the way down my driveway to my mailbox and came back. I'm like, okay, all righty. So A1C normal would be below 5.7. Pre-diabetes, 5.7 to 6.4. Diabetes would be 6.5 or above. So if every time you go in, you're at a 9 or a 10, I guess if I was your doctor, I would be dismissing you from care if I could. Can diabetes be prevented? Dramatic increase over the last 20 years, absolutely. Reducing risk for type 2 diabetes, losing excess weight, exercising regularly, dietary modifications, all great things. And, you know, the gyms are opening back up now. There's no mask mandate. Things are getting busier. And it doesn't have to be, I'm not saying you have to go pump weights 3 times a week, but just going to the gym or just walking, or, you know, I find it amusing that I will see people literally at the gym find the closest spot to the gym. I'm thinking, well, wait a minute. I guess if it's 20 below zero, yeah, I get that. But really, you couldn't park a little bit further away. You have to be, you know, park. I don't get it. So blood glucose response varies by food, and what I said before with the glycemic index. So people like corn. Number one, corn is comes out the same way it went in, pretty much. It's super high in the glycemic index. A lot of it is genetically modified. Produces insecticide, BT, Bacillus thuringiensis, I think is the name of it. It's highly allergenic, right? Yeah, I mean, who doesn't want an ear of corn with some butter and salt on a picnic or occasionally? Yeah, I get it. But it wouldn't be my go-to vegetable per se, unless, you know, if someone was really, really active and they needed some energy, yeah, I guess so. Or, you know, who doesn't like cream corn, I guess. I don't know. But we want to check the glycemic index, like carrots, peas, corn. Is it corn or carrots? One of them has a higher glycemic index than sugar, actually. I should know this. Body's response to carbohydrate food versus a standard carbohydrate. Right? Glycemic index stores and food. So just kind of be aware of what you're consuming. The glycemic index of peas is higher than it would be for broccoli or cauliflower, which is it's how much of that is instantly converted or very quickly converted to glucose. Glycemic load is a glycemic index multiplied by serving size amounts of carbohydrates. All right, so you could have, you know, 2 tablespoons of corn, all right, and not going to be a huge deal. But if you had 2 ears of corn, the glycemic load of that is tremendous. And I've been known to eat 2 ears of corn too, and a chemical hot dog, you know, and I'm still here. All right, so what's the glycemic index? So just looking here, maybe it is corn has a higher index. Something has a higher index than sugar. Maybe it's, I don't know, I should know. But just showing you the glycemic index of certain foods. All right, look at the glycemic index of soda and a banana. Right, banana's huge, huge potassium and carbohydrates. Come on. French fries, that's pure starch. Deep fried, of course. Um, Pasta, I think that's low. It's probably a little higher than that because pasta is really pretty much just flour, bleached flour. All right. Hypoglycemia. This is when people that their blood sugar runs low. This is rare. This will happen to me if I don't remember to eat constantly. keeping that blood sugar level. Sometimes I get super busy and I forget to eat, or I don't have time to eat or whatever, and I didn't, um, shouldn't say I didn't bring, I have things here, um, healthy things like carrots and hard-boiled eggs and weird stuff that I could eat if I get really hungry. Um, so low blood glucose, all right, less than 70, so that's gonna be low. So people are gonna start having brain fog, they might start studying their speech, they might get heart palpitations. Epinephrine, adrenaline goes because you're stressed out, something's going on. You get that insulin or that epinephrine spike. Right. And then reactive hypoglycemia. So people that have hypoglycemia, they get really dizzy, things can get white. I've seen people completely pass out, um, for a minute or two and then come to and not know what happened. All right, metabolic syndrome. So men have this, you'll see this, men and women do too, where they have these humongous apple or pear-shaped bodies. So their stomach is out so far that it lifts their shirt up or whatever. So they have a large waist circumference, usually puts a lot of pressure on the diaphragm, which puts a lot of pressure on the heart and the respiratory system. Chronically high blood pressure because of the being overweight. And I said before, you have to have so many the capillary beds, miles of them, and your heart has to pump that distance through those little tiny, tiny capillaries. So it puts a lot of high blood pressure. Chronically high fasting blood fats, all right, just the disaster. Um, low fasting, high density lipoproteins, the cholesterol levels high. I said before we need some cholesterol, but your body should be sending it back to the liver to regenerate that and send it back structurally back to the cells or the cell membranes. Increased risk of heart and blood vessel diseases, absolutely. All right, tooth decay, we don't see this hopefully as much anymore because people are, brushing their teeth, but this is someone who was literally living on candy, or this could be from uh, mothers who give their baby a bottle before they go to bed and they're having their mouth, they're sleeping, they've got all that milk sugar or the sugar from the juice on their teeth, all right? So it's causing that strep viridans, strep mutans to start fermenting that on their teeth and they're producing acids and eroding the enamel. All right, so simple sugar, there's bacteria, nursing bottle syndrome, like I said, with milk or fruit juices. So limit simple sugar consumption, floss and brush regularly, routine dental checkups for kids. All right, lactose intolerance. So they don't have lactase, so they can't produce lactase. If they have bacteria in the large intestine, it's going to produce a lot of gas. Intestinal cramps, bloating, gas, diarrhea, because there's great big huge chains of sugar that are going through the digestive system, not being broken down and digesting. It's causing a lot of osmolarity. It's pulling fluid. All right, and the bacteria are going crazy with that great big chunk of sugar, digesting it, giving off CO2. Right? So lactose intolerance, who's at risk? People who can't produce or don't have lactase, you can get lactate. The enzyme's already broken it down. I have a problem with milk. Some people have milk allergies, all right, and that's a legit allergy. All right, not just inability to digest it, they have an allergy to it. All right, alternatives would be soy milk, pre-treated products, lactase, solutions and pills. All right, or you know what, just stop drinking milk. All right. High fiber food consumption, all right, risk reduction. All right, so high fiber keeps you fuller longer, helps with digestive tract mobility, reduces obesity, reduces diabetes, all right. It can reduce cardiovascular disease. And once again, remember, it starts pulling the cholesterol, hopefully from your blood and your digestive tract. All right, so it pulls it out of circulation, so it is not adhering to the vascular walls, causing plaquing and all kinds of things. Prevents constipation, reduces the incidence of diverticular and hemorrhoids because you're increasing that mobility. If you don't have any fiber, your gastrointestinal tract is just kind of squeezing. It's trying to move things, but it's trying to move water. It needs something solid to grab onto and move it in a one-way direction. All right, so that's really the problem with diverticulate. There's so much pressure that it will find the weakest point of that circularis muscle, and it'll just blow out that weak area. And then you have these pouches, and then bacteria gets in there and starts causing major diverticula. And then if it gets infected, now you have diverticulitis. Colorectal cancer association. All right, because if you don't have any fiber, this stuff is sitting in your intestines, all right, for days, right? So think about right now it's June, or in the summer. Think about if you had your garbage in your garbage can at 98 degrees for, 5 or 6 days. It starts to really, the bacteria are loving it. They're going crazy, all right? And it can start inflaming the intestines, and in the reparative process, it speeds up mitosis, can increase the risk for mutation, and increase your risk for cancer. Right? Reduces risk for cardiovascular disease. Right? Like I said, pulling cholesterol out of the bloodstream. High fiber diets reduce blood cholesterol levels, reduce risk of cardiovascular disease, and bile recycling or lack of it. So, bile is there to help emulsify fats. It also inhibits a lot of gram-positive bacteria in your microbiome and your digestive system, and it can help. Fiber can help recycle that bile, right, which you can get as part of bilirubin. It's from broken down red blood cells, right? So it helps recycle that. Right? So high fiber diet increases volume of food eaten, right? Stomach fullness and lower energy content. So you're fuller. Hopefully you're having some insoluble fiber, so it's just bulking up. You're not digesting it. Your body's not able to digest it. It's going to give you that full, satiated feeling. It's helping you with digestional peristalsis. It's going to help you evacuate your bowels much easier. You'll be much more regular. And actually, once you get used to this stuff, you won't even touch that white bread anymore. Like that's going to have a lot more body and flavor than eating that white or that bagel or that white bread. That just turns to, it's just bleach and glue. All right. So at least 2.5 grams of fiber per serving. So just start incorporating whole grains, brown rice, wheat germ. Wheat germ is great. You can, you can add that to your salad. You can add it to your smoothie or whatever. It's relatively inexpensive. You can get it at the co-op. You can get it at Wegmans. You can get it at Tops. Fresh, frozen, or dried fruit. They have some fiber in the fruit itself, and especially the peel. Vegetables, nuts, beans, seeds. I love pumpkin seeds, almonds. Right. Right. Some people have, with fiber, they have increased intestinal gas. Right. That can be embarrassing, awkward. So there's stuff called Beano. Other reasons you can have swallowing air, drinking carbonated beverages, and chewing gum. You have a lot more air in the intestines because you're swallowing that. And, obviously you have valve, they're actually called anal flaps, which allow you to, you bear down, the pressure opens the flap so the air comes out, and hopefully the fecal matter doesn't come out. Gross, but anyway. All right, so that ends it. Hopefully this didn't go on for another hour. So I apologize, but I just thought I'd go over it. Stop.